additional procedure that helps to rejuvenate the face is something called a lip lift. A lip lift is definitely a hot topic within plastic surgery. It's how we address the aging that occurs around the mouth. Now, over time, aging around the mouth occurs in different ways. The first is there's bony resorption, so the actual bone that's above the teeth starts to resorb, and that leads to a hollowness just above the teeth and just below the nose. Also, the skin of the upper lip over time can start to hang down and start to become more stretched. This is exaggerated by the use of fillers and other products that add weight to the lip or stretch the lip and then shrink the lip over time. So many patients, even nowadays, that have had a filler process done over years have developed excess skin or a heaviness to their upper lip. This is one great way to rejuvenate the upper lip, and it can be performed in young and old patients depending on their need. So what is a lip lift and how do I do it, and how is this different than what other surgeons do? Well, a lip lift involves removing skin from the area just below the nose and between the nose and the upper lip. But I go an extra step. I also deal with the muscles that are there, the muscles around the mouth and around the upper lip, and the SMAS, or the deeper layer of soft tissue that's there. So where many surgeons just remove skin and close it, I'm actually doing an approach that requires a deeper knowledge of the anatomy that's there. It's similar to a deep plane in what we do in a facelift, where we go below that deep plane all the way to the corners of the lip if needed, to allow us to really fully lift the lip, and not just to remove skin, but to give you an eversion of the lip. It also allows me to plicate the muscles in the upper lip. The muscles in the upper lip move with motion and with talking like this. And if you just remove skin and tighten it, then these muscles get closer together, and it's really difficult for them to move dynamically and normally. So it's important with a lip lift to go and plicate these muscles so that when you do the lift, they're in a natural position to be able to move naturally over time. It's a really critical misunderstanding that a lot of surgeons don't understand, and that can lead to an unnatural moving lip after a lip lift surgery. All lip lift patients have differences in the way that their lip moves over time, and it takes up to 6 months after the initial procedure for your lip to feel normal to you. Although people around you will say that it looks totally normal around the 4 to 6 week time point when swelling has gone down and most of your motion is back. My approach is a little different, and again, it's more of a deep plane approach. It's something that I certainly have studied. I didn't create this approach. This is something that I've learned from another master of lip lifting technique in Beverly Hills, but it's something that I've published on and that I've written about. And I think that it's important to consider not just the skin on the outside, but the dynamic movement of the muscle below and the soft tissues below. So this lip lift can do several things. A lip lift can, number one, help to give better incisor show. It allows you to see more of the teeth in a smile. This is important because a lot of women feel heavy in that upper lip, and when they're smiling, they feel like they're unnatural because when they smile, their lip covers their teeth. If you can remove some of the excess skin and show more teeth, it gives you a much more light, delicate smile on repose. It also allows the lip to evert, so it shows more of the pink part of the lip, and that gives you a natural body and a natural balance. It helps to reduce the need for fillers, and if you do have fillers, it really shows the volume and the moisture content of the lip in a better regard. The last thing that a lip lift can do is it can restore the dynamic movement. Like I said, if the muscle's been stretched from multiple filler injections and a lot of filler over time, by re-tightening that muscle on the inside, it can give you better control and better dynamic movement of your lip. And I think nowadays, more than ever, we see a lot of lips that have been over-injected or have gone through a lot of different procedures. And this is one way, again, to recapture control over your lip over time. So a lip lift can add a tremendous amount to facial rejuvenation. And it's one of the procedures that I like to couple with facelift because it allows me to rejuvenate not just the neck and lower face, but also the mid-face and perioral region. And that, of course, coupled with upper eyelid surgery or brow surgery, allows us to have dynamic control over the full face. It's one procedure that can also be done under local anesthesia. So the beauty of a lip lift is you don't have to be asleep for it. And that is a big reason why many patients choose to go with a lip lift and to rejuvenate their face early on, because again, it's easy to undergo the local procedure. The downtime from the anesthesia is not there, and it's a really rapid recovery process. So a lip lift is a unique and durable way to change the way that the middle part of your face looks, to rejuvenate the face, but also to give natural movement back to the upper lip.